my name is Dr. Karen Howell. I work at Emory University in the medical school, and I work at the Center for Maternal Substance Abuse and Child Development. For the next few minutes, we're going to talk about prescription drugs and your pregnancy. This presentation was a collaboration between the center here at Emory and also the Georgia Prescription Drug Abuse Prevention Initiative, which is part of the Council on Alcohol and Drugs, and was sponsored in part by the Office of Behavioral Health Prevention, the Georgia Department of Behavioral Health and Developmental Disabilities. Prescription drug abuse is a significant and serious problem currently in the United States. The latest information indicates that healthcare providers wrote over 250 million prescriptions for powerful, addictive painkillers in 2012. Many of the highest prescribing states are here with us in the South. Heroin use also has doubled among women in the past 10 years, unfortunately, and women versus men are twice as likely to be addicted to prescription drugs like opiates and prescription painkillers and combine those very powerful prescription drugs with alcohol, which is a particularly dangerous combination. This graph shows the significant increase in the number of opiate prescriptions that have been written in the United States. In the past 30 years, as you can see, there's been a significant and steady increase in the number of prescriptions for opiates that have been written and dispensed. You may be among the many people who are taking one of the two most frequently prescribed opiates, which would be hydrocodone, which is that part of the graph in red, or oxycodone, which is the part of the graph in orange. So overall, what this shows is that the number of opiate prescriptions in the United States has increased more than 300%. Every single day in our nation, drug overdoses kill over 100 people. They send nearly 7,000 to the emergency rooms and take a life through an overdose death approximately every 12 minutes. In 2012, which is the last year that information is available for, over half of drug overdose deaths in the United States were related to prescription drugs. 74% of drug overdose deaths involved two prescription painkillers in particular, hydrocodone and oxycodone. And a third of drug overdose deaths involved very common sedative drugs, things like Xanax, Klonopin, and Valium. For women in particular, prescription drug abuse can be serious and significant. Women of childbearing age are more likely than other age groups to go to the emergency room because of prescription painkiller overdose. In the past 10 years, there's been an over 400% increase in women who have died for prescription painkiller overdoses. And unfortunately, 1 in 10 suicides currently in women involve some use of a prescription painkiller, many times a very powerful opiate. So why do women use alcohol or street drugs or prescription drugs? And one thing we find at the center, and many other programs like ours have found this also, is that there is a very important relationship between a woman's alcohol and other drug use, including prescription drugs, and the alcohol and other drug use of her sexual partner. So the sexual partner's drinking and drug use is a very important predictor of a woman's personal drinking and drug use behavior. So here at the center, we think a lot about the women that we work with, but also her partner And what is the nature and the type of relationship with that woman that we're concerned about her drug use? What is her relationship like with that partner? And that provides very important information for us and for you about your health and also the health of your baby. So, how do drugs affect your unborn child during your pregnancy? So, as you probably know, pretty much everything you consume can pass to your unborn child. So, if you use drugs during pregnancy, they can pass through the placenta to your baby. And the placenta grows in your uterus and gives your baby food and oxygen and very important things through the umbilical cord. But unfortunately, that umbilical cord and that placenta can also pass drugs, including prescription drugs, to your baby during your pregnancy. This slide and the next slide shows some common drugs that can be used during pregnancy and beyond, both the street name and the actual formal name of the drug. This is a good time for me to mention that there is a feedback form at the end of this presentation. So if you have any questions, if there's a drug that you're concerned about that's not on this slide or the next slide, and you have questions or questions about anything related to prescription drug use during pregnancy, please fill out that question on that form and we will individually answer all of the questions that we get. Here's some more examples of drugs that can be used during pregnancy that may cause problems for your baby. So let's talk specifically about prescription painkiller use during pregnancy and how that might affect your unborn baby. When you use opiates during pregnancy, there are two common problems that we worry about. The first is smaller babies that are born too early and too small, and then a very troubling set of symptoms and problems that babies exposed to opiates can have. It's called Neonatal Abstinence Syndrome, or NAS, or sometimes it's called Neonatal Withdrawal Syndrome, or NWS. Let's talk for the next few minutes about what NAS means. Neonatal Abstinence Syndrome is a group of problems that a newborn can experience if that baby was exposed to any kind of addictive, particularly a prescription drug, prescription painkillers, opiates, in the womb while that baby was developing. So the baby, just like you, can become dependent on those drugs, and then when the baby is born, can then withdraw and have abstinence issues after it's born. Any type of drug use during pregnancy can put an infant at risk, but we are particularly concerned about prescription opiate use during pregnancy because of the problem of neonatal abstinence. And in the last 10 years or so, cases of neonatal abstinence syndrome or neonatal withdrawal syndrome have increased by almost 300%. What are some of the problems that we might see if a baby experiences neonatal abstinence syndrome when it's born? And as I mentioned earlier, babies with NAS are more likely to be born small, be born too early. Babies with neonatal abstinence syndrome are also more likely to have breathing problems, problems feeding, may potentially have seizures after birth. And because of these and many other problems associated with NAS, those babies may have to stay in the hospital longer after they're born than if a baby was not prenatally exposed to drugs or experiencing NAS. There are a lot of signs and symptoms that go along with neonatal abstinence syndrome. Some of the more common are tummy problems, problems with reflux or spitting up or vomiting, loose stools, diarrhea, tummy aches and tummy cramps. Babies with NAS can also have problems with feeding, sucking, holding on to a nipple. They also have a group of vague autonomic symptoms or problems with blood vessels, some heart rate problems, some sweating, low-grade fever. They also have mottling of the skin or spots of color all over their skin. They can also be quite agitated, have problems with tremors, have trouble sleeping, have very tense muscles, startle very easily, and then they also can have a fairly characteristic and unique high-pitched cry. One of the most serious problems, the one that we worry about the most, I would say, with neonatal abstinence syndrome would be problems breathing with respiration. That can be a serious and potentially life-threatening problem. So almost every hospital, if they suspect that your baby is having some problems with neonatal abstinence syndrome, will use something that looks like this. You don't have to worry about this. The hospital will take care of this and look for these symptoms. I just thought you might like to see what the hospital will use to help care for your newborn if they suspect NAS. So they'll use this Finnegan. It has a lot of the signs and symptoms that we just talked about and also many others. They'll give the baby scores, and above a certain score, they'll become concerned and maybe start to treat your baby for neonatal abstinence syndrome. So in Georgia, this is a statewide problem. Actually, it's a national problem. Georgia's not the only state having problems with neonatal abstinence syndrome. And you can see kind of county by county which states are reporting some of the issues with neonatal abstinence syndrome. This is from 2012. So the issue of neonatal abstinence syndrome has just increased since then. But as you can see, it is a statewide problem. So how will the hospital treat your newborn if they suspect that he or she has neonatal abstinence syndrome? First, the good news is not every baby prenatally exposed to opiates, to prescription painkillers, will experience neonatal abstinence syndrome or have problems with opiate withdrawal, which is great news. As I mentioned earlier, if the hospital does begin treatment for your baby for neonatal abstinence syndrome, your baby will probably have to stay in the hospital for quite a while. The average length of stay for treatment for NAS is 16 days, so over 2 weeks in the hospital, probably in the neonatal intensive care unit in the NICU. Just like your doctor would treat you for your opiate addiction with another opiate through medication-assisted treatment, the hospital will treat your newborn with a liquid painkiller, an oral opiate. The most common treatment for newborns with NAS would be either methadone or morphine. So what can you do to prevent neonatal abstinence syndrome? First, if you're pregnant and you use any drugs during pregnancy, talk to your doctor, your nurse, or your healthcare provider right away. That's the most important thing. Second, don't stop taking any drug without getting some kind of treatment or information from your healthcare provider. especially if you're taking a prescription painkiller like an opiate. Quitting suddenly or trying to do a cold turkey during your pregnancy can cause serious withdrawal for you and for your baby. We want you to stay healthy. We want you to have a healthy baby. So talk to your healthcare provider before you stop taking any drug, and discuss it with your doctor or your nurse or wherever you get your health care. And then the third most important thing is, if you're not pregnant, please don't use or abuse prescription drugs or street drugs. And if you are using them, quit the street drugs and the prescription drugs along with the care of your doctor before you get pregnant. The best way to prevent neonatal abstinence syndrome is by becoming drug-free before you get pregnant. If you are addicted to opioids, you can get care through medication-assisted treatment. It is the standard of care for pregnant opiate-addicted women. There are commonly used medicines in medication-assisted treatment, such as methadone, buprenorphine. But the important thing to remember is, even if you are in MAT and using the medication-assisted treatment as your doctor is prescribing, it might still cause neonatal abstinence syndrome in your baby. What interventions are needed if your baby is prenatally exposed to opiates and is born? First, if your baby does have developmental issues from your drug use during pregnancy, we would want to know that as early as possible. Early diagnosis for your baby is very important, because with that diagnosis, we can then start to put services in place that will help with your child's development. So early diagnosis, and then any kind of services from the Department of Behavioral Health and Developmental Disabilities. And always remember, it's very important for you to keep your baby and your children safe and free from any kind of sexual abuse, any forms of violence, physical abuse. Those can have very negative impacts on your child's development. So anything you can do to keep your baby safe and free from any kinds of violence will help that development. And then if you need help with parenting, please ask for it. So there are basically two ways to get services for your baby. The first is from the Department of Public Health, which is across the state. It's called Children First, which is sort of the child finder in the state of Georgia. And the specific program, early intervention program for your baby, it's called Babies Can't Wait, which is the statewide early intervention service program for your baby. And then the second option is, we are also happy to help here at Emory. We have a clinic where we see kids who've been prenatally exposed to any and all drugs of use and abuse during pregnancy. So if you have any questions or concerns about the development of your baby, we will be happy to see you also at Emory. Last but not least, there are some wonderful places for further information or for help for both you and your baby. Once again, we're here at the Center for Maternal Substance Abuse and Child Development. We have a wonderful website. We also have that phone number. That's my phone number. You are welcome to call me directly. You can go to the website and get a lot of great information also. Here at Emory, we also have a warm line. It's called Mother to Baby Georgia. You can call or email toll-free and ask any questions about your pregnancy, about your drug use, about medications. Mother to Baby staff are there to answer any questions that you might have. And then there are also other wonderful resources. The Georgia Prescription Drug Abuse Prevention Initiative, their website is Stop RX Abuse in Georgia. There's lots of great information on there. The Center for Disease Control and Prevention has a program that has a lot of wonderful information for pregnant women as well. It's called Treating for Two. And then last but not least, the Georgia Council on Substance Abuse has treatment and recovery information and resources both at their website and at that number that you see on the screen. Thank you so much for listening. Please let us know at the center or at the Council on Alcohol and Drugs if there's any way that we can help further.